So, cognitive behavioral therapy has an underlying sort of orientation that says our thoughts, our moods, and our behavior are all intricately related. And so, with gambling disorder, we look about how there are different thoughts that people have related to their gambling. I'm feeling lucky, how that leads to the behavior of gambling, and how that may influence their mood, or vice versa, that they're feeling down and depressed, or they're feeling very emotionally vulnerable, and the way to settle themselves down is to then therefore go and gamble. And so therefore then they develop the cognition or the thought that gambling is a wonderful way to settle down and take care of myself. It's really important for therapists to learn about cognitive behavioral therapy, CBT, for gambling disorder. CBT is a very flexible and broad sort of definition or term. And so when it comes to treating gambling disorder, there are some very sort of nuances and intricacies that are associated just with gambling disorder. So this workshop, while starting very broad and covering the basics of CBT, will get to be very more specific around conducting a functional analysis, and then subsequently ways to rearrange the environment or to develop coping skills to deal with the idea or construct of wanting to gamble. I really appreciate CBT as a therapy model in that it is highly flexible, that you can adjust for each client as they're coming in the door. There are some basic standard underlying principles that we apply with all clients, but yet it's very flexible in terms of tailoring it towards the individual and understanding their context and their situation. But yet we know it's scientifically based and has been tested and proven, shown to work with a diverse range of clients. And so that's one of the things I really enjoy about CBT. It is structured, but within that structure, you can adjust and tailor as you need. Overall, CBT has been shown to reduce both gambling behavior, so how frequently and often some individuals gamble, and it also shows reductions in terms of a common aspect of individuals with gambling disorder is, we call them maladaptive beliefs or irrational beliefs or cognitive distortions, feelings of I'm going to be lucky, or only recalling the wins that they've had rather than all the losses. And so CBT also changes those over time, which are important predictors and markers of severity for gambling disorder. We also know that individuals with gambling disorder present with comorbid problems such as depression or anxiety. And the CBT that we'll be talking about in the workshop, and the one that's been shown to be effective for in the clinical trials, also addresses the underlying aspects of depression and anxiety.